And so look, I'm going to start with a story, which is CallMe started about just before COVID, and I was doing a routine list. Any patients I talk about today, I've changed names, but they're very happy for me to share their stories. So as an anaesthetist, I had to go and see three patients who needed surgery that afternoon. One was a young adolescent girl called Elizabeth Smith, and two elderly gentlemen with neck or femur fractures. I went down to see Elizabeth. I got her name and everything off the system, printed out the records, went down to see her and got her notes out, checked a consent form, checked her medical history, checked with the receptionist where Elizabeth was. And I went to see Elizabeth in this four-bedded bay. And I was struck by this 14, 15-year-old girl sitting in a bed who was looking a bit surly. And I approached with my normal routine, friendly routine, which is, hello, Elizabeth. I'm Dr. McCabe, one of the sleep doctors. I'm going to ask you a few questions if that's okay, and I'll tell you a bit about what's going to happen today. And this young girl looked at me, and with piercing blue eyes, she basically said to me, and she didn't use these words, I'll be very clear, she didn't use these words, but it was basically, naff off. Anyway, it was clear the message, and I said to her, that's okay, Elizabeth, if you don't feel like talking to me. Am I correct in assuming you're Elizabeth's mum or carer? To this lady who was sitting next to her, middle-aged lady, looked up from her phone like most of us these days. She had a pearl necklace on, and she looked up and she just said, basically, didn't say these words, but she said, and you can naff off. And it was clear, as I'm sure you guys might be parents as well, you'll understand an adolescent kid sometimes has bad days. The mother's been called in from work because the kid's done something at school. There's stuff going on, nothing to do with me. Anyway, I finished the consultation and I went upstairs to do the WHO check before our theatre list, where we all get together and we talk about the cases, equipment needed, any potential issues and so forth. And I said the first patient on the list is Elizabeth, a young girl with a fractured arm. And the surgical registrar just looked up from his piece of paper and said, that's Richard. So this is Richard. Richard's been living as Richard for over a year and a half. Now, when you look in the hospital notes, when you went to page 8, the nursing admission, there was a comment about it. So there you go. That's not very surprising, is it? That Richard and his mum were pretty upset with the hospital system, and just take a moment to think about what that meant for them and for us dealing with it as well. So I left that thinking, good Lord, this is awful in a healthcare situation of all places, and this is going to happen to Richard again if he comes tomorrow. Richard was being called Elizabeth throughout healthcare, and that's just awful. So if you think about it, that's the story that started all this. So in the NHS, we have all these identifiers, don't we? We have the name, date of birth, address, ethnicity, religion, all these things very easy and visible to see. But we don't actually routinely record how people want to be identified. And I don't think any one of you will disagree that it's controversial to suggest that we should be routinely calling people by the name they want in healthcare every time. And it might be an abbreviation, it might be a middle name, it might be the elderly person who likes to Mr. or Mrs. It's just in healthcare, we routinely assume it's the formal forename which we see in front of us. And it's not. So that's CallMe. So this is CallMe. Actually, I'll tell you what it is. So basically, it's a really simple thing. It's just about making sure we try and get the names right. It's about capturing it. And we capture it by putting it into our PAS system. When someone presents our hospital, we say, what would you like to be known as when you're with us? And it might be that they want to be known as something different when they're in healthcare as they do in routine life or with their friends or elsewhere. So it's not an assumption you can make. Now, once we ask it, we have it recorded and it's put into our PAS, so we've got it. So if they come back again, and heaven forbid they come back in A&E or for any other reason, we've got a note of what we think they like to be known as to start with for future presentations. Display. So it's one thing to record it, but it's another thing to have it. It needs to be visible and easy to find. And also, it's about a cultural change. The cultural change that's making people realize that the numbers you'll see later on, people prefer to be known by something that might not be their first formal forename. So I'm going to show you here, this is what it looks like for us. So this is a picture of a name band at the top, and you'll see we've got the CallMe mic there. So it's in italics, it's away from all the other identifiable data. Having it on the wristband is really important because that's showing the patient, the family, the next of kin also that we're respecting this thing about their identity. So if I was going to check me in for theatre, and we use the wristbands a lot for checking in for lots of things. If I was going to check myself in for theatre, I would say, hello, I know you're known as Mike, but we're going to do some formal checks. Your formal name is Michael McCabe, your date of birth is blah, 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 blah. We have a sticker on the front page of every note, on the front page of every drug chart still in our trust, on the front chart of every lots of observation things we have still. So picking it up before you see the patient, I would have seen CallMe Richard, for example, before you go and see the patient. So it's a nice thing to go in using the name they want to start with. So we did this by putting the field in a vacant field on our PAS system, and we did this for the great cost of basically £150. That's the whole cost for this whole project has been for 3 banners for when we launched it for our comms team. It's simple and easy, and we've done it very cheaply. So when you think about names and you think about yourself, when you think about who am I, you think about the name you use, and it's how others use, and that's how people see you as well. So here's like 4 of the names we've got of our trust. These are real people, all these different versions that people use. I'm just going to point out Elizabeth I've got there. I've got a mother called Elizabeth. Actually, she goes by Liz. And I've got a daughter called Elizabeth, named after her grandmother. She goes by Lizzie. Muhammad's up there. 40% of the people with the forename Muhammad on our system, on the NHS system, when they come into our hospital, if we ask them, say, actually, don't call me Muhammad, call me this. Okay? So Christopher's the highest scoring one, but I'd say it'd be easy, but very wrong to assume that all of these people are Chris's. I'll tell you, they're not. So in our trust, we've done this, and we've done it now for 250,000 people, okay? And when you ask the questions, this is what you get. 1 in 4 across all age groups, actually, when you ask them, say, actually, I prefer this. And that increases up to 29% in people over the age of 65, okay? There's very little published on this, and oddly enough, the only international thing that's published about what people like to be known as when they're in a hospital comes from Australia, a tertiary hospital, where they did only 300 patients, and funny enough, they've got 30%, so very similar to us. And I just want you to translate those numbers of the 1 in 4 and the 29%. So conservatively in England, in the last hour, since you guys were sitting down and getting ready for this meeting, there's been 14,000 hospital attendances by people presenting for care. There you go. That's 3,500 people in the last hour who've turned up for healthcare, preferring to be known by a name that's not their formal forename. So you could say, well, what's the significance of this? And I'm going to suggest to you there's lots and lots and lots of layers to this. Firstly, it's a very nice, simple thing to ask people. It's going to make them feel respected, that your identity is being respected, even if they're very happy to go with their first formal forename, which the majority of people are. But I'm sure hopefully you can see each of these groups, the significance of these people. You think about it. I'll just take you through the post-stroke aphasia. The Stroke Association tells us that 1 in 3 people turning up to A&E suffering from a stroke have issues with communication. So if you're over the age of 65, there's a 29% chance that you prefer to use a different name to what that first formal forename is when you were there. Think of this as your mother, your grandfather, your child. I want to share one patient that sticks with me since we've launched CallMe. This is a young chap who had a neurodegenerative disease like Stephen Hawking. He was unable to talk, so he had a tracheostomy. He was unable to feed. It was a neurodegenerative condition, and he was a frequent flyer in our ENT ward. And he had 24-hour care around the block. So when he came into our hospital, he would have a carer with him the whole time, as well as our hospital staff. And I went to see this chap because he was coming to theatre. And he had a CallMe of Kostos, but he had a very long Greek name. And I was talking to the carer and Kostos, and I said, has the stickers made any difference to the care you've received? Are people getting your name right? And the carer said something striking. She said, well, actually, to be honest, the nursing care know Kostos. They've always called him Kostos, and that hasn't been an issue. But the thing that's made a difference is with agency nurses, with doctors, with paramedical staff, all the others Now they get it as Kostos. Before they were calling him this other long name, which he never used. Think about that. That's a man that can't even speak for himself. I put other areas down at the bottom, and I just want to share, there's a really nice aspect to this as well. Kids with nicknames. Bubblegum Fairy. So I go and see a child, and I see her call me a Bubblegum Fairy. I go into the room now, and I say, hello, you must be Bubblegum Fairy. That's an immediate communication improvement. It makes a huge, the parents smile, the kid smiles. It just gets everything off on the right foot, and a really nice thing to do. But you can also appreciate that people waking up from an operation, people unconscious or arousable. If you're in that 29% of the people over the age of 65, we're shouting in your ear saying, wake up, are you okay there, Bob? Or if you go by something else, we get it wrong so often. And this is not just our trust. This is every trust. We're better than most people now because of CallMe. Here's another aspect to it. The 2021 census in England and Wales said there's 56 million people. 7 to 10% of that of the population fall into that group on the right side where they don't use anglicised forms of our name. Think of all those people presenting up today in healthcare in England, where we're just assuming rather boldly and rather insultingly, I'm going to suggest, not intentionally, but that's the way the systems work, that we're getting that wrong. Think about the difference when we get it right, which we should. So, look, there are some regulations out there that suggest we should be getting it right. The CQC has its own that says, actually in Regulation 10, it actually says patients must be addressed by the way they prefer. And there's Equality Act issues, which suggest, I would strongly suggest, it's in law that people should be called by the name they want to be called. So I did a freedom of information request, and the CQC says, well, yeah, it's really important. We can't measure it. We don't do anything about it. We can't do anything about it. We think it matters, but we don't track it. So I'm sure most of you, if not all of you here, will agree that this is a sensible and a good thing to do. And it's very, very easy for people to see that and to acknowledge it. I sometimes say, and I'm not a gambling man, but I'm going to say this right now. If any of you people listening today can't think of someone who's close to you, who you care about, doesn't use a different name to their first formal forename, I would walk down Oxford Street wearing a chicken mask, a whole chicken suit, without any doubt. This affects lots of people. So that's me as a clinician, seeing this issue, addressing this issue locally, getting the numbers and showing that this is a real thing. But taking it forward, I'm not sure even I understand. You guys understand much more about this than I do. One of the problems is there is preferred name fields in lots of various healthcare systems, but they're not routinely filled in. They're not routinely shared. If they're not filled in, does that mean they're not been asked or has been asked? They're not available for clinical use. The CallMe needs to be available on the top of a screen when we see their name, their forename, their date of birth, all this other identifying. It needs to be visible and free and in our clinicians' faces as we're seeing patients. It needs to be, in my opinion, it needs to be a standard. It just feels wrong that it's not a standard in the NHS. You guys will know about this a lot more than I do, obviously, but I'm going to suggest, could it not be a part of the single patient record as one of the core dataset measurements? Could it not be in part of the NHS app where people got access to it themselves? Could it not be regulated that this needs to be visible at a point of care? And could it not be made somehow that CQC, they can say that it's important, but it needs to be measurable, and it's not measurable. Look, I'm delighted to say, and hopefully be relieved to say that we're almost at the end now. So CallMe launched about 5 years ago. This is a website. If you feel like it and you've got a cup of tea later on and someone in your household is watching Love Island or some horrific program, get on your phone, have a look at the website, okay? It's got videos of the different perspectives for staff about this, for patients about this. It's got some lots of reference things which we're very keen for people to use and share. This is an idea that it needs to go out there. Thank you very much for listening. Okay, I know your time's valuable. I hope I've taken up less than the allocated time, because that's always a bonus in any presentation, I think. So this is just the right thing to do, but it's not going to happen, obviously, without people like yourselves spreading it up and out to get questions answered, which is beyond my scope. But that's CallMe. That's come from Worcestershire. They're the numbers of 250,000, which I think are quite striking. And I'd very happily welcome any questions, comments, suggestions, anything you want to feedback. I'd be grateful. Thank you very much.